Illnesses and injuries can happen suddenly in the workplace. If you know how to recognize an emergency and know what to do, you can make the difference between a quick recovery or a long illness. And you may make the difference between life and death. Hello, and welcome to the American Heart Association's Heart Saver First Aid course. In this course, you will learn about the most common life-threatening workplace emergencies. You will learn how to recognize them, how to call for help, and how to perform life-saving skills before professional help arrives. This course will help you learn in several ways. Your manual covers all of the material in this course. This video will give you facts and show you important skills. You will also practice some of the skills. This will help you remember what to do in a real emergency. You can learn even more after the course by viewing the extra information on the included CD-ROM. The quick reference guide included in your manual will also help you remember what to do in an actual emergency. You should keep it handy. What you learned today could save the life of a coworker or a loved one. You can make a difference. Good luck. We hope you enjoy the course. Let's talk about some general principles you need to know. These principles apply in all emergencies.
These two first boxes, stacks right there. Okay, what I need you to do, if you can, is get some guys over here and load up. See, the BL23, this last one here. All right, good.
You're Joe Smith, right?
Yeah.
Hi, I'm Mary, the plant nurse. I hear you've agreed to be a first aid rescuer in Building B during your shift. I can't tell you how much we appreciate it. We need someone like you on every shift.
Okay, now, I don't know anything about first aid.
It's not a problem. We'll send you to the American Heart Association Heart Saver First Aid course. You'll learn when and how to phone for help and what to do until emergency rescuers arrive. That's first aid.
So do I need to help every time somebody gets really sick or gets hurt? What if I make a mistake? I mean, can I get in any kind of legal trouble? Or?
The Heart Saver First Aid course will teach you everything you need to know. When you're at work, you'll need to help. Outside of work, you can use your first aid skills if you want to, but that's up to you.
Okay.
Look, Joe, nobody expects you to have the knowledge or skill of a doctor or professional rescuer. You just have to act responsibly when you help a victim.
All right.
Come on, let me show you our first aid kit.
Okay.
Here it is.
What's an AED?
An AED is used to shock the heart. Not all companies have one, but we do. You'll learn how to use it in your first aid course. Whenever you're called on an emergency, bring this kit with you or send someone to get it. Don't worry, you'll learn how to use most of this in your first aid course. Just remember, when you use something, replace it. That way the kit will always be ready.
Huh. You know, I've always wanted to help people. I just never really knew how. What if somebody gets hurt and they don't want my help?
That's a good question. Anyone who's awake and understands has the right to refuse help. When you arrive at the victim's side, introduce yourself. Tell them you're trained in first aid and ask if you can help. If the victim doesn't want your help, phone our emergency response number and stay with the victim until help arrives. If the victim looks confused or can't answer, assume he or she wants your help. You're gonna do great, Joe. It's not that hard. The most important thing is that you want to learn how to help.
You may have to give first aid in some dangerous places. Before you start, always check to see if the scene is safe. The victim may be in a room with poisonous fumes or on a busy street. No matter how busy things are, you should be sure everything is safe for you and the victim. Remember, consider safety first.
Hey guys, yeah, you too. I need your help. Stay here and stop all traffic.
Why don't I just help you move her out of the way?
No, she can't be moved. I need you to keep this area safe by stopping all traffic. Ma'am? Ma'am, can you hear me? My name is Maria. I'm trained in first aid. May I help you?
Okay.
Where's the closest phone?
I have my cell.
Call 911, call for help. Ma'am? Ma'am, can you hear me? My name is Maria.
You can't help someone else if you're injured yourself. When you approach a victim, take a quick look around. Make sure the scene is safe. You usually don't move a victim, but you may need to if the scene is unsafe. When you look around, check for these things. Is there danger for you? Is there danger for the victim? Are others around to help? How many people are injured? How were they injured? Where's the nearest phone? What is your location? Your first aid kit includes personal protective supplies to help keep you safe from blood and other body fluids while giving first aid. You should use these whenever it's appropriate. So when is it appropriate? Well, basically, you should wear personal protective equipment if possible whenever you give first aid and CPR to anyone outside your family or as part of your job responsibilities. However, when you give first aid at home or to your immediate family, you can decide whether you want to use gloves or other equipment or not. Sometimes the outside of your gloves may come in contact with the body fluids of an injured person. For your safety, you must be able to remove your gloves without touching the outside with your bare hands. So now your instructor will pause the video so that you can get into position to practice taking off gloves. Okay, you should be in position to practice removing your gloves. You can practice along with the video as we go. Ready? Begin. First, grip one glove on the outside near the cuff and peel it down until it comes off inside out. Cup it with your other hand. Next, place 2 fingers of your bare hand inside the cuff of the glove that is still on your other hand. Peel that glove off so that it comes off inside out with the first glove inside it. As you can see, both using and removing gloves correctly are important steps when it comes to your safety and the safety of others. Disposing of gloves properly is important too. Do not throw the gloves in the trash. If your workplace uses biohazard bags, then put them in one. Another part of being safe is washing your hands to prevent illness. If possible, wash your hands before giving first aid, but always wash them with soap and water after tending to a sick or injured person and after removing gloves. Germs can spread easier than you think. If by chance blood or body fluid does get on you, wash it off with soap and lots of water right away. If you can't wash right away, use waterless hand sanitizers and wash your hands as soon as you can. Use a paper towel to turn the faucet on and off so you don't contaminate others. Remember, always wash your hands and wash them thoroughly. If the victim's blood or body fluid splashes in your eyes or on your mouth, rinse well with lots of water. Report what happened to your company's emergency response plan supervisor and your doctor. Dispose of any biohazard bags according to your organization's rules for biohazard waste. If you don't have access to a biohazard bag, put the gloves in a plastic bag and seal it. Talk with EMS personnel or your local hospital about how to throw out anything with blood on it. Now, as we go through the course today, you're going to have a chance to practice skills that would require you to wear gloves. Instead of actually using gloves for every practice, you'll need to say out loud, "I'm wearing gloves," as you begin. This way you won't have to actually wear gloves every time. The American Heart Association's chain of survival shows the most important steps in dealing with life-threatening emergencies. The first link in the adult chain is to phone for help. Your company should have an emergency response plan that includes how to phone for help in an emergency. In many workplaces, that number is 911. Another part of being ready for emergencies is to have a well-stocked first aid kit. Your instructor will now pause the video and direct you to the page in your manual that details the recommended contents for a first aid kit. Knowing how to phone for help and how to answer a dispatcher's questions are important tools when helping any victim. Some areas use the number 911 to contact emergency medical services, or EMS. Others have a specific emergency response number. Some places need to dial 9 or another number to reach an outside line before calling 911. Make sure you know how to phone for help for your location. Write down all emergency numbers in a place close to the telephone where everyone can see. Generally, you should phone for help whenever someone is seriously ill or hurt, or you're not sure what to do. When the dispatcher answers, you just need to answer some questions about the emergency.
911, what is your location and what number are you calling from, please?
We're at 354 Westview. We're on the 5th floor in the southeast corner of the building. And the phone number is 555-3434, extension 34.
Okay, sir, can you tell me what the emergency is?
We've had an employee collapse. He was fine just a few moments ago, and then he just slumped to the floor.
I understand. Can you tell me your name, sir?
My name, Max Bowen.
Okay, Max, is the victim conscious?
No, he is not.
Is he breathing normally?
I don't think so. A co-worker's giving breaths.
Are you able to assist with CPR?
Me? No, but she knows CPR, and she's doing it now.
Okay, good. Is there an AED there?
Yes.
Okay. An ambulance is on the way. I need for you to stay on the phone with me until I...
In an emergency, if someone else is available, send that person the phone for help and get the first aid kit and AED while you stay with the victim and begin first aid. Whenever phoning for help, don't hang up until the dispatcher tells you to. Before you can help someone who's in trouble, you have to know what the problem is. Your instructor will now pause the video to let you get into position to practice finding the problem. Pair up with a partner. When the video restarts, we'll first explain how to find the problem. Then you will take turns being the victim and rescuer, practicing along with the video. In an emergency, as soon as you're sure the scene is safe, you must find out what the victim's problem is. Try to look for the problem in an orderly way. First, look for life-threatening problems. Find out if the victim responds. To find out if the victim responds, tap the victim gently and shout, "Are you okay?"
Mike, are you okay? Are you okay?
The victim may respond or they may not respond, or may not respond normally when you tap their shoulder and shout. A victim who doesn't respond or doesn't respond normally will not move, talk, or answer questions. If the victim does not respond or only moans or groans, check whether the victim is breathing normally. The muscles in the back of the throat may relax in a victim who does not respond or does not respond normally. When this happens, the tongue falls back and blocks the airway. If the airway is blocked, the victim cannot breathe. To open the airway, do a head tilt chin lift. This pulls the tongue away from the airway. To do this, tilt the head by pushing back on the forehead. Lift the chin by putting your fingers on the bony part of the chin. Lift the chin to move the jaw forward. Do not press on the soft tissues of the neck or under the chin. Now that the airway is open, look to see if the victim is breathing normally. While you hold the airway open, put your ear next to the victim's mouth and nose. Look to see if the chest rises. Listen for breaths and feel for breaths on your cheek.
His air passage is clear. He's breathing.
Once you know that the victim is breathing normally, then look for signs of bleeding.
I don't see any bleeding.
Maybe he has a medical condition.
Well, he's not wearing a medical brace. Let's check for a necklace.
I found it. It says he has a heart condition.
So what's the problem?
Medical information jewelry will tell you if the victim has a medical condition. If the victim responds and can talk, introduce yourself. Ask if you can help, and ask the victim what the problem is. Let's summarize how you approach a victim and find out what the problem is. First, check the scene to be sure it is safe. Next, tap the victim's shoulder and shout to check for a response. If the victim responds, ask if you can help and ask what the problem is. If the victim does not respond or moans or groans, phone for help. Then open the airway with a head tilt chin lift. Next, check for normal breathing. Look for bleeding. Look for any medical information jewelry. Now it's your turn to practice finding the problem. You should already be in position to practice. So, if you're ready, begin. First, check the scene to be sure it is safe.
Okay, the scene is safe.
Next, tap the victim's shoulder and shout to check for a response.
Hey, are you okay? Are you okay?
If the victim responds, ask if you can help and ask what the problem is. If the victim does not respond or moans or groans, phone for help.
You call 911 now.
Then open the airway with a head tilt chin lift and check for normal breathing. Look for bleeding and any type of medical information jewelry. As a first aid rescuer, you don't need to decide if the victim needs medical care after the emergency. The victim, your workplace policy, or EMS rescuers will make that decision. You may learn private things about your coworkers. Even though you must give all information to EMS rescuers and your emergency response plan supervisor, you should never talk to other coworkers about a victim. Keep private things private. Don't answer questions to satisfy the curiosity of a coworker. Once an emergency is over, you may feel let down. These feelings are normal, even for experienced rescuers. You had lots of responsibility during the first few moments of the emergency. When someone else takes over, you may feel pushed aside. If the outcome isn't good, you might feel guilty or blame yourself. It's important to discuss your feelings with a counselor, doctor, nurse, or some other healthcare provider. Remember, you played an important role in giving first aid.
Hey, Joe. I heard you did a really good job helping Mr. Wade.
Oh, well, thanks. Yeah, it felt good to help.
You know, if you ever want to talk about it, I'm available. There's just one more step, Joe. Our company requires that you fill out this paperwork after you've given first aid.
Okay. Well, I'll go get this done then. Oh, and thanks again, Mary.
This concludes our discussion on the general principles of first aid. By now, you should know how first aid can help, how to protect yourself and the victim, when to phone for help, how to find out what the problem is, and what to do after an emergency. Your instructor will now pause the video and give you a short test to see what you've learned about first aid basics. We're now going to present first aid for some common medical conditions. First, let's look at the things that can cause breathing problems. Breathing is usually smooth and easy, and we hardly notice it. If someone suddenly has trouble breathing, it's an emergency. The signs of breathing problems are breathing very fast or very slowly, having trouble with every breath, noisy breathing as air enters or leaves the lungs, or does not have enough breath to make sounds or speak more than a few words at a time in between breaths. Usually people with breathing problems know about it and often carry medicine, like an inhaler, but may need help getting it. They should feel better within minutes of using the inhaler.
Roland?
The first aid actions for someone having a breathing problem are to stay with the victim. If the victim has medicine, get it. Phone for help if the victim has no medicine, does not get better after using medicine, has trouble speaking, or stops responding. Be prepared to start the steps of CPR if the victim stops breathing. Stay with the victim until trained help takes over.
So I need to get you directions.
Yeah, and I also need to know what time it's going to be, because...
It's at 7? You
7
need to
o'clock.
go get a gift, too.
Oh, I'll wait.
Are you choking? Let me help.
Now let's talk about a common breathing problem, choking. In adults, choking is often caused by food blocking the airway. The block in the airway may be mild or severe. If the block in the airway is mild, the victim can make sounds and cough loudly. In this case, stand by and let the victim cough. If you are worried about the victim's breathing, phone for help. If the block in the airway is severe, the victim cannot breathe, talk, or make sounds. If this happens, you must act right away and give abdominal thrusts to try and clear the airway. You will know that the block in the airway is severe if the victim can't breathe at all, has a cough that is very quiet or has no sound, can't talk or make a sound, has high-pitched, noisy breathing, has bluish lips or skin, makes the choking sign. First, ask if the victim is choking.
Are you choking?
If the victim nods that he or she is choking and cannot talk, you must act.
I'm going to help you.
When a victim is choking, you need to give thrusts slightly above the belly button. Kneel or stand firmly behind the victim and wrap your arms around his or her waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the stomach. In a real situation, you would give thrusts until the object is forced out and the victim can breathe, cough, or speak, or until they stop responding. If you cannot remove the object, the victim will stop responding. In this case, yell for help. And if someone comes, send them to phone your emergency response number and get the AED. Lower the victim to the ground, face up, and start the steps of CPR. Every time you open the airway to give breaths, open the victim's mouth wide and look for the object. If you see an object, remove it with your fingers. If you do not see an object, keep giving sets of 30 compressions and 2 breaths until the victim starts to move or trained help takes over. If the choking victim is in the late stages of pregnancy or is very large, put your arms under the victim's armpits and your hands on the center of the victim's chest. Pull straight back to give the chest thrusts. You can help someone who's choking by taking quick action. So let's get into position to practice. Right now, everyone team up with a partner. Practice the correct hand placement for performing abdominal thrusts that you just saw. Then switch roles. Keep in mind that in a real situation, if the victim was a child, you may have to kneel. Do not actually perform thrusts on your partner. This is just a practice session, and doing real thrusts could hurt someone. Your instructor will pause the video now so that you can practice. We've all seen someone with a mild allergic reaction. The signs of a mild reaction are a stuffy nose, sneezing and itching around the eyes, itchy skin, or a rash. Mild allergic reactions are annoying, not dangerous. But some people have bad allergic reactions and can die if they don't get first aid right away. People who know they have bad allergic reactions may carry epinephrine with them and know how to use it. People can have bad allergic reactions to lots of things: eggs, peanuts, chocolate, and insect bites and stings, especially bee stings.
Are you going to the stuff
Probably.
That's 7, right?
Mm-hmm.
I think we got a good chance.
Oh, man.
Yeah, I agree.
It's a bee. Ah.
Okay.
I got stung by a bee. I'm allergic, man.
The signs of a bad allergic reaction are trouble breathing or swelling of the tongue and face, fainting. Is that bad?
Get my lunchbox out of the truck, will you?
Need some help. Help!
I'm trained in first aid. Can I help?
I'm allergic. I got stung.
Call 911.
Epinephrine pin.
All right. Can you give this to yourself?
Shouldn't he be getting better?
Takes a while. Just relax. Breathe. Breathe.
If the victim is able, let him or her give the injection. If the victim can't give the injection, you can help give it if you have been trained and your state and work site allow it. To use the epinephrine pin, take off the safety cap. Hold the pin in your fist without touching either end and press the tip of the injector hard against the side of the victim's thigh, about halfway between the hip and the knee. The needle is designed to go through skin and through clothing. Hold the pin in place for several seconds. After you take it out, make sure you don't put your fingers over the end that has been pressed against the victim's thigh, because that's where the needle is. Rub the injection spot for several seconds. After using the injector, put it in a safe container like this one, according to your company's policy. If you don't have a container for sharp objects, do not replace the safety cap. Note the time of the injection for EMS rescuers and give them the tube for proper disposal. Now it's your turn to practice using the epinephrine injector. You will be using a trainer which doesn't have a needle or any medicine. Pair up with a partner and take turns following along with the video. Your instructor will pause the video for you to get ready. Okay, you should be in position to practice using an epinephrine pen. Ready? Begin. To use the epinephrine pen, take off the safety cap. Hold the pen in your fist without touching either end and press the tip of the injector hard against the side of the victim's thigh, about halfway between the hip and the knee. Hold the pen in place for several seconds. After you take it out, make sure you don't put your fingers over the end that has been pressed against the victim's thigh. Rub the injection spot for several seconds. A heart attack is a serious medical emergency. A person who is having a heart attack usually can respond but may deny having a problem. If someone has signs of a heart attack, call the emergency response number or 911 right away.
I'm trained in first aid, Jim. What's wrong? What can I do to help?
I'm having pressure right here. Just give me a minute. I'll be okay.
Phone the emergency extension. It's 212. Tell them someone's having chest pressure, and they'll call EMS.
Come on, guys. I'll be okay. Just let me rest. There's probably heartburn from the lunch Sid brought me. I don't want to worry anybody. I'll really feel bad if we miss this deadline.
Many people with an uncomfortable feeling in the chest don't want to believe that it could be a heart attack. If someone has signs of a possible heart attack, you must act and phone for help right away, even if the victim does not want you to. Act quickly. The first minutes of a heart attack are the most important. That's when a victim is likely to get worse or even die. These first minutes are also important because many of the treatments for heart attack will be most successful if they are given soon after the signs of heart attack begin. Signs of a heart attack may include chest discomfort in the center of the chest that lasts for more than a few minutes, or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. The uncomfortable feeling may be in other areas of the upper body, such as one or both arms, the back, neck, jaw, or stomach. Shortness of breath. Other signs may include cold sweat, nausea, or lightheadedness. The uncomfortable feeling of a heart attack is usually in the chest and may involve either one or both arms, the neck, the jaw, or the back between the shoulder blades. If someone has signs of a possible heart attack, you should have the victim sit quietly. Phone for help, or send someone to phone for help, and get the AED and first aid kit. If the victim stops responding, be ready to start the steps of CPR, and use the AED if your company has one. Fainting is a short period when a person stops responding for a short time and then seems fine. A person who faints usually gets dizzy and then stops responding. Fainting most often happens when someone stands without moving for a long time, especially if it's hot, suddenly stands after squatting or bending down, receives bad news.
I feel dizzy. Can I help you? Yes, please. Why don't you just lie down on the floor until the dizziness goes away?
If you're asked to give first aid when the victim is dizzy but still can respond, make sure the scene is safe and help the victim lie flat on the floor. After a victim faints and then starts to respond, you should do the following. Ask the victim to lie on the floor until the dizziness goes away. If the victim remains dizzy, raise the victim's legs about 12 inches and keep them raised until the victim is no longer dizzy. Look for injuries from the victim's fall. Once the victim is no longer dizzy, help the victim sit up very slowly. The victim should sit briefly before slowly getting up. Diabetes is a condition in which the body doesn't make enough insulin. People with diabetes need insulin shots. Insulin helps turn sugar into energy. If a person with diabetes doesn't eat enough sugar for the amount of insulin injected, the blood sugar level may drop. Low blood sugar causes the victim's behavior to change. The person may become irritable, confused, hungry, thirsty, weak, or sweaty.
I feel like at this time we really need to consider closing one of our warehouses. What do y'all think about that?
I think that's a good idea.
Do you?
Might have to happen.
I just think we.
I disagree. I disagree. I think it's a stupid idea that could ruin everything. It just doesn't.
Emma.
Horrendous. It just
Emma,
would
you're not acting like yourself. He's got a medical bracelet on. She's diabetic.
We haven't had lunch.
Exactly. Would you go get Emma a soft drink or orange juice or even a packet of sugar? Don't bring a diet drink. It doesn't have sugar in it. She needs sugar. Emma, it's going to be all right. Just want you to sit quietly for a while. Would you feel better if you lie down?
Oh.
Do you think you could eat something and swallow?
No.
Just wait. We're going to get you something, okay?
Here's the orange
Thank
juice.
you. Here's some orange juice, Emma. I need you to drink this. I need you to drink a lot of it, okay? That's good.
Doing good, Emma.
Okay, you're gonna feel better now, all right? Let's have some more.
Signs of low blood sugar can come on very quickly in someone with diabetes. If you see signs of low blood sugar, you should take the following first aid actions. If the victim can swallow, ask him or her to eat or drink something with sugar, like a non-diet soda, fruit juice, or even a packet of real sugar or honey. Remember, don't use diet soda or sugar substitutes because they have no sugar. Have the victim sit quietly or lie down. If the victim cannot swallow or isn't better within a few minutes after eating something containing sugar, phone your emergency response number or 911. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or bursts. When the stroke is caused by a clot, some victims can receive new treatments that can lessen brain damage. Clot busters must be given in the first hours after a victim suffers a stroke, so it is important to recognize the signs of a stroke.
Oh.
Expedite that. What else?
Marla, are you okay? It's Lonnie. I'm trained in first aid. Is there something I can help you with?
I have a headache. And my arm is feeling funny.
The warning signs of a stroke are sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headaches with no known cause.
Okay, we're gonna get you some help, Marla. Everything's gonna be okay. I'm gonna stay right here with you. Call 911, tell them that we have a woman who's having trouble speaking, and she can't move her right arm. Okay, go. Oh, bring back a first aid kit.
Oh.
Marla, you're gonna be okay.
Okay.
I need you to lie down, and I'm gonna help you do that now, okay? You're gonna be just fine.
If you see signs of a stroke, make sure the scene is safe. Phone or send someone to phone for help and get the first aid kit. Help the victim sit or lie down. During a seizure, a victim may lose muscle control, fall to the ground, or stop responding. The victim usually has jerking movement of the arms, legs, and sometimes other parts of the body. Most seizures stop within a few minutes. The most important first aid action for a victim having a seizure is to protect them from injury by moving furniture or other objects out of the way and by placing a pad or towel under the victim's head. Then phone or send someone to phone for help. Stay with the victim until he starts responding. After a seizure, check to see if the victim is breathing. If the victim does not respond, start the steps of CPR. If you don't suspect a head, neck, or spine injury, roll the victim to his side. After a seizure, it is not unusual for the victim to be confused or fall asleep. There are also some things you should not do when giving first aid to a victim having a seizure. Do not hold the victim down. Do not put anything in the victim's mouth.
What happened?
She got hit by a car.
Shock develops when there is not enough blood flowing to the most important parts of the body.
On either side. Has anybody got a cell phone?
A victim in shock may feel weak, faint, or dizzy, have pale or grayish skin, act restless, agitated, or confused, be cold and clammy to the touch.
Now, how are you feeling?
My stomach's starting to hurt real bad. The car hit me right here, and I feel real dizzy and kind of cold.
First, make sure the scene is safe for you and the victim. Phone for help. Help the victim lie on his or her back. If there is no hip or leg injury or pain, raise the victim's legs about 12 inches and rest them on something like a box or rolled up coat. Use pressure and gauze to stop any bleeding you can see. And cover the victim with a blanket to keep them warm.
We're going to raise your legs a little. Would you open this silver blanket for me, please? Are your legs hurt?
No.
All right, I'm going to raise your legs, and you let me know if it hurts when I do.
Okay.
Lift her legs while I do. Thank you. Okay, are you all right, Frida?
Yeah.
All right, now we're going to put a blanket over you, and this will help keep you warm. Just tuck it in down by her feet. Let's get it all the way up around her shoulder.
This is what the steps of shock management look like when they're put together. First, make sure the scene is safe for you and the victim.
Okay, the scene is safe.
I'm cold, weak, and dizzy.
Phone for help.
You, phone for help.
Help the victim lie on his or her back. If there is no hip or leg injury or pain, raise the victim's legs about 12 inches and rest them on something like a box or rolled up coat. Use pressure and gauze to stop any bleeding you can see. And cover the victim with a blanket to keep them warm. Now it's time for you to practice checking for signs of shock and giving first aid for shock. Your instructor will pause the video for you to get into position to practice. You will pair up with a partner so that you can take turns being the victim and the rescuer. This concludes our discussion of medical emergencies. By now, you should know how to recognize and respond to several common medical emergencies, such as breathing problems, including choking, and bad allergic reactions. You've learned how to use an epinephrine injector, how serious chest pain and heart attack can be, and how to respond to emergencies involving fainting, low blood sugar, stroke, seizure, and shock. Your instructor will now pause the video and give you a short test to see what you've learned about medical emergencies. Much of the first aid you will give will be for injuries that are common in the workplace. Many of these injuries involve bleeding. We have divided bleeding into two types: bleeding you can see, because it is bleeding on the outside of the body, and bleeding you can't see, because it is inside the body. Bleeding that you can see can be frightening, but the fact is that you can stop most bleeding you can see with pressure alone. The most important thing is to stay calm. Bleeding often looks a lot worse than it is.
What happened?
Man, I cut my hand. Knife slipped.
Listen, it's okay. I know first aid. I'm gonna help, all right?
All right.
So get this fixed. I'm gonna try and stop the bleeding, so I gotta press down hard. Your hand's still bleeding, so I'll get an extra gauze.
Take the bloody one off?
No, because it might pull off the clots and make the bleeding worse. I'll press harder on this extra gauze. I should be able to stop the bleeding with a little more pressure. I think the bleeding has stopped now.
Take the following first aid actions to stop bleeding you can see. Be sure the scene is safe for you and the victim. Send someone to get the first aid kit. Wear personal protective equipment. Use pressure to stop the bleeding. If bleeding does not stop, apply more pressure. If you still can't stop bleeding, apply a second dressing and press harder. Do not remove any gauze once it's in place. Check for signs of shock. Now we'll show you a demonstration of what the steps for stopping bleeding you can see look like. Afterwards, you'll get a chance to practice what you learned, so pay close attention. First, make sure the scene is safe for you and the victim. Then put on personal protective equipment.
The scene is safe. I have gloves on.
Use pressure and gauze to stop the bleeding. If bleeding does not stop, apply more pressure. If you still can't stop the bleeding, apply more gauze and press harder. Do not remove any gauze once it's in place. You should be able to stop most bleeding with pressure over plenty of gauze. Phone for help if there is a lot of bleeding, if you can't stop the bleeding, or if you're not sure what to do. Your instructor will now pause the video for you to practice stopping bleeding. You will practice using pressure with gauze for bleeding you can see. Pair up with a partner and take turns being the victim and rescuer. As a rescuer, you may be asked to help someone who has a nosebleed or is bleeding from the mouth. There are some things you can do to help stop this bleeding.
Jess, they called and said you were having trouble. What happened? Can I help?
Yeah, I need help. I don't know what happened. My nose just started bleeding.
Okay, well, come sit down for me. I'm sure you're gonna be all right. Okay, right there. No, lean your head forward. You don't want to lean your head back when you're trying to stop a nosebleed. Okay, I'm gonna pinch your nose pretty hard with this gauze for several minutes.
A nosebleed is bleeding you can see, so the first aid action is to stop the bleeding with pressure. First, make sure the scene is safe. Put on protective equipment. Ask the victim to lean forward. Press both sides of the victim's nose with gauze for a few minutes until the bleeding stops. If bleeding continues, press harder. Phone for help if the bleeding does not stop in about 15 minutes. If the bleeding is heavy, such as gushing blood, or if the victim has trouble breathing. Like other bleeding you can see, bleeding from the mouth can usually be stopped with pressure. A mouth injury can be serious if blood or broken teeth block the airway and cause breathing problems. If bleeding is coming from the tongue, lip, or cheek, and you can reach it easily, press with sterile gauze or a clean cloth. If bleeding is deep in the mouth and you can't get to it easily, or you don't know where it's coming from, ask the victim to lie on his or her side and phone for help. Check for signs of shock and watch the victim's breathing. Sometimes when a person suffers a mouth injury, one or more teeth may become broken, loose, or knocked out. This can be a choking hazard. First, make sure that the scene is safe for you and the victim. Send someone to get the first aid kit. Put on personal protective equipment. Check the victim's mouth for any loose or missing teeth or parts of teeth. If a tooth is loose, have the victim bite down on a piece of gauze to keep the tooth in place and call the dentist. If the tooth is chipped, gently clean the injured area and call a dentist. If the victim has lost a tooth, rinse the tooth in water, put it in a cup of milk, and immediately send the victim and tooth to a dentist or emergency department. Tell the victim to talk with a dentist if a tooth changes color after an injury. A victim's eye can become irritated from a scratch or either a small or large object in the eye. Usually it's just a small piece of dirt, an eyelash, or pollen. First, make sure the scene is safe. Get the first aid kit. Put on personal protective equipment if appropriate. Use a generous amount of fresh water eye wash to rinse the object from the eye. Make sure the eye with the irritant is the lower eye as you rinse the eyes. Make sure you don't rinse the irritant into the unaffected eye. If the object does not come out with rinsing, or if the victim complains about extreme pain, phone the healthcare provider. Tell the victim to keep both eyes closed until trained help takes over. If a victim experiences a hard hit to the eye or has an object puncture the eye, you must seek emergency help. This can happen from a direct punch to the eye, a hit to the side of the head by a ball or other object, a high-speed object like a BB pellet, or a stick or other sharp object. First, make sure the scene is safe. Phone for help, then get the first aid kit. For a puncture, cover the eye with a clean, dry dressing. Tell the victim to keep both eyes closed until trained help takes over. Puncture wounds occur when a person is injured by a sharp object, like a sharp stick or knife. If the object is stuck in the body, don't take it out. Here's why. If you take the object out, you could cause more damage and more bleeding. Do not remove the object. First, make sure the area is safe. Phone 911 and get the first aid kit. Put on personal protective equipment if appropriate. Try to stop any bleeding you can see. You'll also want to look for signs of shock. Amputation is an injury that causes bleeding. Amputated body parts, such as a finger or toe, may be able to be reattached. You can preserve a detached body part at room temperature, but it will be in better condition to be reattached if you keep it cool. If you are giving first aid to a victim with an amputation, first make sure the scene is safe. Phone for help and put on protective equipment. Stop bleeding with pressure. You will have to press for a long time with very firm pressure. Look for signs of shock. To save the amputated part, rinse it in clean water. Then cover it with a clean dressing and place it in a watertight plastic bag. Place the bag in another container with ice or ice and water. Label it with the victim's name and make sure it gets to the hospital with the victim. Do not place the amputated body part directly on ice because extreme cold can injure it.
Hey, Matt!
What?
I need you to check in a new shipment for me.
What?
I need you to check in a new shipment for me.
Look, I'll be right there in a second.
What? God! Move the lift back. Move the lift back.
I didn't see him. I thought he saw the lift.
Look, down 9 to get an outside line. And down 911, all right? Just relax, man. Are you all right, man?
My sword is killing me.
Okay, it's okay. Just lay your head down for me. Oh. Yeah, it looks like it got you right there, man. Just lay your head down. Relax, relax.
Oh, I'm feeling dizzy.
It's okay, Matt. Listen to me. You may be bleeding inside your body, all right? Does it hurt anywhere else?
It's just on my side.
Here. Look, give me a box of socks so I can put his feet up, okay? Just relax your legs. Just relax, man. It's okay. I want you to just stay calm and lie still for me, okay? Okay. It's gonna be all right. Okay. All right, listen.
Let's talk about another kind of bleeding you can't see. A strong blow to the chest or stomach or a fall can cause injury and bleeding inside the body. You may not see signs of bleeding on the outside of the body or at all, or you may see a bruise on the skin over the injury. An injury that has caused bleeding you can't see could be minor or very severe. You should suspect bleeding inside the body if a victim is injured by a car or bicycle crash or pedestrian injury, a blast, a fall from a height, a knife or gunshot wound. You should also suspect bleeding inside the body if the victim has an injury to the stomach or chest or has bruises or pain in these areas after such an injury. The victim might also have shortness of breath, cough up blood, or show signs of shock. If you suspect bleeding you can't see, you should first make sure that the scene is safe for you and the victim. Phone or ask someone to phone for help. Have the victim lie down and keep still. Check for signs of shock. If the victim stops responding, send someone to get an AED if available and start the steps of CPR. The brain is protected by the bones of the head but can be injured if someone is struck hard on the head or falls from a height. Head injuries can cause damage to the brain and even death. Suspect a head injury if the victim fell from a height, was injured by a strong blow to the head, was injured while diving, was electrocuted, was in a car crash or involved in a bike accident. Signs of a head injury are: the victim does not respond or only moans or groans, is sleepy or confused, vomits, complains of a headache, has trouble seeing or walking, or has a seizure. The bones of the spine protect the spinal cord. The spinal cord carries messages between the brain and the body. If the bones of the spine are broken, the spinal cord may be injured and the victim may not be able to move his or her arms or legs and may lose feeling in part of the body. You can cause further injury to the spinal cord if you bend, twist, or turn the victim's head or neck. The signs of a spine injury are an injury to the upper part of the body, especially the head or chest. An injury was caused by a falling object, a forceful blow to the head or chest, a motor vehicle crash, or a fall from height. Or if the victim was injured while under the influence of alcohol or drugs. Follow these steps when giving first aid for a possible head or spine injury. Make sure the scene is safe and phone for help. Hold the head and neck so the head and neck don't move, bend, or twist. Don't turn the victim unless they are in danger. Injuries to bones, joints, and muscles are common in our active society. These injuries may include joint injuries, broken bones, and bruises.
Hey, Bo.
Thanks. Hey, Dee.
How are you?
Fine, how are you?
Good.
Great. Hey, are you going to make it to the company softball game tonight?
Make it. I'm playing third base. I'm going to catch all those pop flies you hit.
Oh, you are?
Yeah.
Well, get ready, because they're going to be coming right over your head, okay?
All right.
All right.
Hey, I got to go. I'm late for a meeting.
I'll see you.
Oh! Oh, my ankle! God.
I'm so sorry.
Chief, what happened? You okay?
Oh, I tripped over that dolly.
Okay, I'm trained in first aid. Can I help you?
Yeah.
Lenny, get that dolly out of here.
Oh, man.
Grab me the first aid kit, a bag of ice, and a towel.
You got it.
Okay?
What about a chemical cold pack?
No, that doesn't get as cold. A bag of ice, please.
You got it.
Oh, this really hurts.
So sorry this happened to you. Okay, hang in there. Hold on.
Okay.
Thanks, Lenny. Okay, perfect. Now I'm gonna put some ice on your ankle. And this is gonna help reduce the pain and the swelling.
Oh, it's really cold.
And then we're gonna take it off every 20 minutes, okay? Now after the ice, I'm gonna put an elastic bandage on your ankle. Let's not walk until we get some medical attention, okay?
Okay. Thanks, Bo. It's a good thing you were here.
Oh, I'm just glad I could help. Of course, somebody else is gonna have to catch my pop flies tonight.
When giving first aid for a victim with a possible broken bone or sprain, make sure the scene is safe and get the first aid kit. Check for signs of shock. Don't straighten any injured body part that is bent. Cover open wounds with a clean dressing. Put a plastic bag filled with ice on the injured area with a towel between the ice bag and the skin for up to 20 minutes. Raise the injured body part if doing so doesn't cause the victim more pain. Phone for help if the wound is large and open, if the injured part of the body is abnormally bent, or if you're not sure what to do.
Oh!
Larry, are you okay?
Oh, I burnt myself with the coffee. It
Okay,
burns.
Larry, I need you to put your arm into the water for me. Okay, I'm gonna go get the first aid kit.
Follow these steps if the burn area is small. Make sure the scene is safe and get the first aid kit. Cool the burn area immediately with cold but not ice cold water. Hold the burn area under cold tap water for about 15 to 30 minutes. You may cover the burn with a dry, non-sticking, sterile, or clean dressing. Phone for help if there is a fire, if the burn area is large, or if you're not sure what to do. Burns can be caused by contact with heat, hot surfaces, or liquids, steam, electricity, or chemicals. There are some things you should not do for a burn. Do not put ointment on the burn. Do not put any medicine or household product on a burn. Do not put a home remedy such as butter, petroleum jelly, or oil on a burn. Remember, if there is a large burn or a fire, phone for help.
Oh, he's on fire! Call 911! Stop moving around! Drop! Stop running! Drop to the ground and roll! Stop to roll! 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 Keep rolling! Roll! 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 Stop!
It's out. It's out. It's all out. Your shirt's burnt. We're gonna have to get it off. Let's get it off.
It's good you remembered stop, drop, and roll. People don't realize when they run, they fan the flames. I guess they just panic.
I was scared too.
You did a good job. You did a really good job.
Thanks.
The first aid actions for burns caused by fire are to make sure the scene is safe and get the first aid kit. If you have any questions about safety, phone for help. Make sure the scene is safe. If the victim's clothing is on fire, have them stop, drop, and roll. Cover the victim with a blanket and soak with water. Once the fire is out, carefully remove burned clothing and jewelry from the burned area. If the victim stops responding, start the steps of CPR. Remember to phone for help if there is a fire, a large burn, or you're not sure what to do. Electricity occurs naturally in the form of lightning or from man-made sources like electric current from an outlet or electrical wire. Electricity can cause burns on the surface and injure organs inside the body. If electricity enters the body, it can cause severe damage. You may see marks or wounds where the electricity has entered and left the body. Injuries from electricity may seem very small, but the electricity can leave a lot of damage to organs inside the body and even stop the heart. Remember, you can't tell from the outside how much damage there is inside the body. If an electrocution is caused by high voltage, like a fallen power line, immediately notify the proper authorities. Phone or ask someone to phone for help right away and bring the first aid kit and AED. Don't enter the area or try to pull wires or other materials until the power has been turned off. Don't touch a victim if they are still in contact with the power source. Electricity can travel from the source through the victim to you. It's best to turn the power off at its source. The switch is usually near the fuse box. In giving first aid to someone with an electrical injury, make sure the scene is safe. Don't touch the victim if the victim is still in contact with the power source and the power source is on. Phone or ask someone to phone for help and get the first aid kit and AED. If the electrocution is caused by high voltage, such as a fallen power line, call the proper authorities right away. Don't enter the area around the victim until the power is turned off. Check for a response, look for signs of shock, and give first aid as needed. A healthcare provider should check all victims of an electrical injury. This concludes our discussion of injury emergencies. By now, you should know how to recognize and respond to several common injury emergencies, including bleeding you can see, bleeding you can't see, and shock. You've learned how to recognize injuries to the head and spine, bones, joints, and muscles, as well as injuries caused by burns and electricity. Your instructor will now pause the video and give you a short test to see what you've learned about injury emergencies. Congratulations. Today you have learned many skills that will serve you forever. Remember, you must practice what you learn. Use it or lose it. The knowledge you have can change and or save many lives. On behalf of the American Heart Association, thank you for taking time to attend this important course.